All right, health insurance, day 2 of this 3-part series. Yesterday, I told you today would be the 2 most expensive options because yesterday, being on your parents' plan, free, working part-time at UPS, and getting health insurance through UPS, not only is it offered, there's no premium, which is better than most jobs. Most jobs like offer it, but you still need to pay a premium. They're just like letting you have the option of taking them up on it. UPS, you don't even pay premiums. You just have it. Anyway, at least last time I was there. So, the 2 most expensive options. One is Obamacare or something like it. In some states, Obamacare is a thing. In others, I see basically the characteristics of it, but not the word Obamacare. But it's an income-driven plan. Based on your income, you pay a certain rate. They're not going to make people who make very small amounts of money pay the same as someone who makes well over $100,000 a year. So whether or not it's Obamacare or it has a different title, you could sign up for an income-driven plan. I'm not a fan of them just because of the headaches, the hassles. You might get to a point where, I was looking in California, you're eligible for Obamacare if you're a California resident if you make between, I think it was 128% of the poverty line and 400% of the poverty line, which is roughly between $21,000 and $58,000. You might have Obamacare. You might be offered a promotion and a raise at work, and that might put you over $58,000, and all of a sudden you're not eligible for it anymore. That's why I don't like income-driven plans. You need to make sure you're making a small enough amount of money. It's odd sometimes, but that option is there if you want to look into it. I didn't look up all 50 states, but there is the official title, Obamacare, and there are other states that have income-driven plans. 4th option total in this mini-series, second today, is to just buy a plan on the private marketplace. Think of car insurance. People don't have jobs and are offered car insurance through their employer. You have a car, you go to a place that offers car insurance, Geico, Progressive, and you say, I would like car insurance. You just go there and ask to buy it. You can do that with health insurance. It's not required that you get it through an employer. You could go to the private marketplace, you could browse the plans, you can compare the plans, and you can purchase a plan. And this is actually what I did in 2020. So I was getting health insurance through the University of Nebraska-Lincoln when I was a law student. That ended, I think, when the summer semester ended, was technically the last day I had it. And I didn't have an on-the-books job. And I went to the private marketplace and bought a private health insurance plan. So not like the income-driven plan. Your income doesn't matter if it's low, if it's medium, if it's high, whatever. You have it. You're never in danger of losing it as long as you keep paying the premiums. And those are out there. I actually hear a lot of dealers, because it doesn't sound like there are a ton of dealers who are full-time and getting benefits, poker dealers. And I don't know, some of them don't seem to know that it's an option to just go to the private marketplace. If you have a family, I think it's way different. But if you're just a single person who is dealing however many hours a week, it's a pretty solid amount of money. And even if your employer is not offering you a health insurance package, you could go to the private marketplace and use some of your money to buy a health insurance plan. So that option is out there. So these 2, you actually have to pay for both. There are premiums associated with both. Yesterday's, there weren't, but these are 2 options. If your income is low enough, or if you don't care about doing all the paperwork to say what your income is and to worry about, oh, well, because that's the thing. If you're a poker player or self-employed in any respect, your income is going to fluctuate. If you have an on-the-books job, like when I was in IT, I had a salary. That was it. Occasionally, if I stayed there for a long time, there could have been raises. But I knew well in advance what my pay was going to be. Anything self-employed, including poker, you don't. So your income might drop too low, and you might not be able to get Obamacare. Your income might be too high one year, and you won't be eligible for it. So these were today's 2 options: an income-driven plan and just buying a plan on the private marketplace. Tomorrow, 5th option, last option, one that I think is really never considered for the correct reasons, or very rarely, but an interesting option that I think most people should consider and they don't. And remember, rice is a spoon food.